Good morning, everyone. My name is JP Bewley. I'm the co-founder and CEO of EVO, and we're doing something amazing. We're taking data off of all of these connected health devices like Garmin, Fitbit, Apple Watch. We're analyzing it in real time in the cloud. We're applying Nobel Prize-winning science to provide in-the-moment health guidance and coaching in a round-trip time of about 3 minutes and bringing it back down to the individual user, as well as their insurance company and their clinicians. Insurance companies are using this platform globally to assess the risk of the lives that they're insuring and to engage their customers after the sale. Clinical trials and clinical research are using this to assess the health of their patients, as well as assess the health of subjects going through clinical trials. So let's meet EVO. EVO is a first-of-its-kind artificial intelligence platform that starts by downloading a smartphone app. We designed it to be simple and elegant way to onboard new customers and to ask them basic questions like demographic information, such as their height, their weight, their age, and their gender. But we do a lot more than that. We give them a short-form personality test that helps them classify them into archetypes. And those archetypes help us understand the relationship that they have with their health, the level of confidence that they can embark on lifestyle behavioral changes, and how many times we can engage with them. But because there's a lot of sensors in a smartphone, and not every user out there has a Garmin, an Apple Watch, or a Fitbit, we have the ability, and we've developed within EVO, the capability to capture rich biometric data streams like heart rate, respiration, and gait mechanics simply on the smartphone. Because of this technology and this award-winning science that's behind it, the companies that we partner with are using this in some really interesting ways. So let's talk about a few of those. Each year in the United States, 28 million times life insurance policies are written. And the process works pretty much the same way that it has for the last 30 years. But it takes between 3 weeks and 3 months to complete. A user applies. They schedule a medical professional to come to their house who asks them questions about their family medical history. They weigh them. They take their blood pressure. And unfortunately, they stick them with a needle. And I don't really care that much for needles. As I mentioned, this process hasn't changed in about 30 years. And the life insurance companies spend between 130 and 140% of their first-year premium revenues to acquire this customer, between marketing cost, medical underwriting cost, and agent commissions. If you think about the fact that 1 year later, out of all the customers that apply, 1 out of 4 are not a customer for a 20-year policy at the 1-year anniversary, there's a huge ROI opportunity for engaging the customers after the sale and speeding up this process and making it much more seamless. That's why National Australia Bank's MLC division and Swiss Re use our product with every new life insurance policy that they ship. There are 5.5 million Americans that have Alzheimer's, and it's a terrible and debilitating disease that affects your quality of life in a lot of different dimensions. There are a lot of these types of diseases that pharmaceutical companies around the globe are researching drugs that deliver better quality of life and ultimately, hopefully, find a cure. But if you're working on a drug that's supposed to improve quality of life metrics, like increase the mobility of a patient or change the way that they sleep in a positive way, how do you know that it's really working without following them around all the time? This is the reason that Merck Pharmaceuticals is using our product in 11 countries to monitor patients going through FDA drug filings. And this one, I think, is probably the most important and most powerful. Every 11 seconds. Every 11 seconds in the United States, an elder American is treated in the emergency room for a fall. It is the leading cause of death among our senior citizens. And that's really sad when you consider that the ability to assess fall risk really can start with how fast that elder American walks, as well as how stable those gait mechanics over time. And because we're on the wrist and we're always observing and analyzing this data in real time, we have the ability to assess fall and frailty risk in an always-on type fashion. And that's the reason, after a successful pilot with the Chilean government in Valparaiso, that they're now replicating our platform with us in Chile to change the way that they engage with their senior citizen networks. And we've done this across 12 different sites in the United States as well. On top of these rich data streams, we've leveraged our data science background to develop signature scores that link back to EMR data and logging of adverse events that tell us when changes to health are occurring. Things like how the heart changes during the sleep cycle, disruptions to sleep mechanics, and the gait stability that we talked about for fall risk and frailty. This is a massive market opportunity. The global wellness economy is almost $4 trillion, and the connected device market is $22 billion and growing at a double-digit compounding annual growth rate. Software and analytics within that is $8 billion, and that's where EVO's squarely designed to focus. We sat down with the largest reinsurance companies in the world and their innovation teams like Munich Re and Swiss Re and RGA, and we said, what do you think's missing in the marketplace to really disrupt the way that you underwrite and engage with the customer after the sale? And in partnership with them over the last year, we've invested $1 million to change the way that we assess health and engage with the customers after the sale by using up to 800,000 data points per person per day to change the personality and the conversation that EVO has with each individual. And we've designed it to work with any device on the marketplace so they're no longer bound to any particular device, including the device that each of you have in your pocket, your smartphone. As a result of this science and technology, we've had tremendous traction in the marketplace, and this year we'll do $1 million in recurring software revenue. We're seeking a partner to help us on a $5 million raise to expand our sales and marketing team, to support the partnerships we have, like with Reinsurance Group of America, who has insurance relationships in over 60 countries, and to continue to realize our big vision of where we believe EVO can go. And what's best about this is I stand here before you today, we have a market-ready product that you can download from the App Store, and I'd like to invite all of you to download it and experience what day-to-day coaching can provide for you in your daily life. If this is something that you're interested in and you'd like to talk to us more about it in the days and weeks ahead, please contact us, try EVO, and we look forward to talking to you in the future. Thank you very much for your time.